Good morning, everybody. I'd like to call to order the February 15th, 2024 meeting of the Human Services Committee. And this is the first meeting of the Human Services Committee of the 2024 legislative session. So I want to welcome all you Human Services folks back. At the beginning, we do have a couple of new introductions to make. So I want to, first of all, welcome back our intrepid clerk, Chandra Prasad. Thank you, Chandra, for making our lives so much easier. We are also joined by two new assistant clerks, Rebecca McClanahan and Ashley Orser. Thank you both. From OLR, we have Mary Fitzpatrick and Sarah Leeser, no relation. OFA, we have Lindsay Donston, Rachel Della Pietra, and Emily Shepard. From LCO, we would be nowhere without our fearless attorney, Marie Grady. And Marie's here. Okay. Of course, Marie's here. Marie we could not have a human services meeting without Marie. From HDO policy, we are joined again by Brittany Kane. From the Senate Democrats, we have Dana Nestor and Julia Famularo. From House Republicans, Adam Johnson. From Senate Republicans, Sean Cleary. We are also joined by a new member. And I'd love to turn it over now, if I could jump out of order, because we're supposed to have remarks by chairs and ranking members, but I'd love to turn it over to Representative Heffernan if he wants to make a quick introduction, tell us about himself.
Hello. Well,
Good
new at this, as you probably know. I'm Bill Heffernan. I'm from West Haven and 115th. Just happy to be here. Hope I can help the committee out, and let me know what you need. Thank you.
And with that, I'd like to turn it over to my ranking member, very much not my ranking member, my co-chair, Representative Gilchrist. I will not be getting any bills called in the House this year. Representative Gilchrist for any opening remarks.
Good morning, everyone. I'm glad to be back for another year. Just want to let folks know that it might seem a little light on human services. There's many meetings going on, and so many of our members are in and out. And we will be holding votes open at this point. We're hoping at 1:30 because people are in and out. But just good to see everyone. And let's get going.
All right. Now I would like to turn it over to my our real ranking member, Representative Case.
Thank you, Senator. And as the good chair, Representative Jillian said, a light meeting, but not a light meeting with 38 concepts. Very robust agenda this year. We're doing some good stuff in screening. Senator Staminera is ranking member on aging. So as many have said here today, we're all bouncing around. So she's covering for me over there. I'm covering for her here. And let's just get some things rolling. Thank you.
Thank you. All right. So moving right along, as Representative Case mentioned, Senator Staminera is in another meeting. So we're going to go straight to item number 3, concepts to be raised. I think what probably makes sense is for me to go through each item, quickly describe it as best I can. I will perhaps call a friend or Representative Gilchrist for assistance on a couple, but and then we'll entertain a motion after each summary. So number 1 on the agenda is what it says it is. It is the recommendations of the Wheelchair Repair Task Force, which was perhaps the most intense task force we've had in this building in a little while. Entertain a motion to raise item number 1.
So moved, Representative Nathan.
So motion made by Representative Gilchrist, second by Representative Cook.
Senator Lesser?
Yes, Representative Case.
Can we begin a consent calendar, please, and add number 1 on consent?
Without objection, number 1 will be added to the consent calendar. Number 2, an act implementing the task force recommendations for the elderly nutrition program. That was another rollicking task force we had. Is there, and it does what it says it does. Is there a motion to raise item number 2? Motion by Representative Cook. Second by Representative Gilchrist. Is there any discussion? Representative Case.
Senator Lesser, I move that to the consent calendar, please.
Without objection. Number 3, an act increasing rates of Medicaid reimbursement for certain providers. That also does what it says it will do. But we are looking to, we just received back the Medicaid rate study from Department of Social Services. We are looking to reform the rate making process in various respects. This is a vehicle to do so. Is there a motion to raise item number 3? Motion by Representative Gilchrist, second by Representative Heffernan. Is there any discussion?
Senator Lesser, I move that to the consent calendar, please.
Without objection. Item number 4, this is an act concerning Medicaid coverage for infertility treatment. Again, this is a repeat from last year. It is specific, though, only to the Medicaid portion. It does not cover private insurance. Is there a motion? Motion by Representative Gilchrist. Is there a second? Second by Representative Heffernan. Any discussion? No discussion. The clerk will please call the roll.
Senator Lesser,
Senator Lesser, aye.
Representative Gilchrist, Senator Seminara, Representative Case,
To draft, yes.
Senator Gaston,
Gaston, yes.
Representative Dathan. You're muted.
You're muted, Lucy.
Representative Dathan votes yes. Apologies.
Thank you. Senator Marr,
Senator Marr votes yes.
Representative Butler, Representative Comey,
Representative Comey votes yes.
Representative Cook, Representative Fortier, Representative Heffernan, Representative Hughes,
Representative Hughes votes yes.
Representative Johnson,
Representative Johnson votes yes.
Representative Kitt,
Representative Kitt votes yes.
Representative Leeper,
Representative Leeper votes yes.
Representative Santiago,
Yes.
Representative Buckby,
Representative Buckby votes yes to draft.
Representative Ferraro,
If this is for draft, I vote yes, reserve the right to change once I see the draft. Thank you.
Representative Mastro Francesco,
No.
Representative Pizzuto,
Yes to draft.
Representative Paletta,
Okay, the clerk will hold the votes open to a time we will announce later, but we believe it'll probably be 1:30. So it will be 1:30 unless something strange happens. Number 5 on the agenda, an act concerning fuel vendor reimbursement under the low income home energy assistance program. And I would just say a couple things. One, we thank everyone for their support yesterday. Human Services led the charge, passed the first bill of the year. We were able to appropriate an additional $13.5 million in heating assistance funds. But one of the conversations that came out of that was figuring out ways to make the program work better and to streamline its operation. And so this is a vehicle for discussion, not just about the subject matter, but about low-income heating assistance in general. Is there a motion to raise? Motion by Representative Case, second by Representative Cook. Yes, Representative.
I just have a question, Mr. Chair.
Yeah, absolutely.
The funds for this particular allocation are coming from ARPA, is that correct?
Sorry, the funds that we voted on yesterday, yes, are from ARPA. The bill before us, though, number 5, does not have, it's not an appropriations bill. It's about streamlining the program.
Okay, thank you very much.
Thank you. Any other questions? Representative Case?
Yeah, I'd like to move this to the consent calendar.
Without objection. Item number 6 on the agenda, an act preserving assets of state humane institution residents. And I would phone a friend on this one. Representative Gilchrist, would you describe what this bill does?
Yes, thank you, Senator Lesser. A few years back in this building, we were able to address what are called welfare liens. Connecticut was one of 2 states that required folks who had received benefits to pay them back later in life. And so folks were losing their homes. This is in some ways a cleanup. We did not get rid of all welfare liens. And so this addresses that. Thank you, Senator.
Thanks for the reminder. Any discussion? Representative Case?
We can move this to the consent calendar, sir.
Without objection. Item number 7, an act establishing the Bureau coordinating services for deaf, hard of hearing, and deafblind persons. Motion by Representative Case, second by Representative Cook. This is a proposal we received actually from the Speaker of the House to improve services for the deaf, hard of hearing, and deafblind persons and restore a cut that was made a few years ago.
Consent calendar, please.
Oh, and Representative Poulos, yes. Representative Case has made a motion to add this to the consent calendar. If there is no objection, we will do so. Item number 8 is an act concerning homelessness, and this is a vehicle for discussion. We understand that the majority of homeless services have been transferred to the Department of Housing and therefore to the Housing Committee, but there is a nexus with Medicaid funds for health-related social needs, and so this is a vehicle for discussion about how the areas of the budget and the departments under this committee's cognizance can help. Motion by Representative Case, second by Representative Cook. Any discussion? Yes, Representative Francesco.
Thank you, Mr. Chairman. Just quick question. I know you did mention that this really should go to housing. Is the intent of this just to have a discussion here and then possibly transfer this bill over to housing to come out of there?
I think there was a very large TBD on that. I think it's a good question, but to some extent, cognizance is determined by the screening committees of each house, of each chamber. We do know that there is a portion of the homelessness discussion that has to do with DSS, but whether it goes to housing afterwards, that would make sense. But I don't think we've figured that out yet.
Okay, thank you.
Yeah,
I will.
Representative Johnson.
Just a point of clarification, this is a program that has been put into effect for the last 5 or 6 years, and it utilizes Medicaid funding to keep people in their homes when they were once homeless. And so when it first started, it started in certain parts of the state, and if they were incurring a bill of about $40,000 or more a year in Medicaid costs, then these funds were being used to make sure the people were housed so that it would reduce the Medicaid cost. That's why it's in Human Services. So it's an excellent program. It actually was started in Arizona by having some of the Human Services directors all throughout the country look at this access to Medicaid to stop homelessness for people that have these problems. So it is a Medicaid issue and it is a Human Services issue. Thank you so much, Mr. Chair.
Thank you, Representative Cook.
Thank you, Mr. Chairman. I would recommend that if we do have something that would overlap, that possibly we could bring housing in, do a joint hearing or some type of informational if it gets to that point, only because some of it will cross over. But I do agree with my colleague that the funding does lie here. So thank you.
As the vice chair of the Housing Committee, I think that's a great idea. I mean, it keeps me from having to be in 2 places at once. Representative Gilchrist.
And I would just flag for folks that there is an informational forum tomorrow on housing that the Human Services Committee is taking part in at 10 a.m. An informational hearing on the state of housing, Connecticut, the economic and human impact.
With the Housing Committee.
With the Housing Committee. And others.
And Planning and Development. Yeah. Any other discussion? If not, Representative Case?
I move this to consent.
Hearing no objection. All right. Item number 9, an act concerning a janitorial work program for persons with a disability and persons with a disadvantage. Motion by Representative Cook, second by Representative Heffernan. I will just say briefly that this is a proposal from the Department of Administrative Services. We're looking forward to hearing more from them about this issue. Representative Case.
Move this to consent, sir.
Thank you. Without objection. Item number 10, an act concerning Medicaid coverage for remote fetal monitoring. My understanding is that this is a new technology that is out there. It's exploration about cost benefit and to see if this makes sense for the Medicaid program. Is there discussion? Or is there discussion? Is there any motion? Is there a motion by Representative Gilchrist, second by Representative Johnson? Any discussion? Yes, Representative Master Francesco.
Thank you, Mr. Chair. Just a quick question on this remote fetal monitoring. This is for Medicaid coverage. Do we know if this is covered on the exchange as well?
I don't know that. Representative Gilchrist, do you know that? We don't know. That's a good question.
Maybe we can find out during the public hearing.
Absolutely.
Thank you.
Representative Case.
We can move this to consent, sir.
Without objection. Item number 11, an act concerning Husky C. This bill seeks to strike the asset limit on Husky C. Is there a motion to raise? Representative.
So moved.
Motion by Representative Hughes. Is there a second? Second by Representative Heffernan. Any discussion? Yes, Representative Master Francesco.
Thank you. So this is to strike the asset limit on Husky C. Can you elaborate a little bit more? What is the asset limit now? I'm assuming this bill is already prepared and I'm not really familiar with it, or it's in the work, or there's discussion, we'll say.
Not a problem. There are a lot of bills in this building. This was a repeat from last year. There is a spend down associated with the Husky C program, which primarily provides care for people with disabilities and older residents. This would make it easier to access the program without having to limit. Right now, I think the asset limit is extremely low. And so you basically have to have no assets whatsoever to qualify. And so this makes it easier to access the assumption that people will access it eventually anyway, but we don't necessarily need to force people with disabilities and poverty. And it's been brought to my attention that Representative Dathan has her hand raised on Zoom.
Thank you very much, Senator. This is a huge issue in this community, not just for, elderly disabled folks, but for people who are in Husky C. It is basically every month they have to spend down and are not allowed to kind of save up for things like maybe a car repair or if they have an overage in their heating or other programs. And it really is awful, and we need to address it as part of our state budget. Many states in our country do not have asset limits, and I'd really like this to be a key part of the discussion because the rates are so low right now compared to our other Medicaid programs. So really try to bring things in parity. So thank you for letting me speak.
Thank you, Representative. Any other discussion? Senator Seminar?
I believe this needs to go on consent.
I'm not going to argue with you. If there is no objection, hearing no objection will be placed on the consent calendar. Number 12 on the agenda, is an act eliminating the income and asset limits in the MedConnect program. So moved. Motion by Representative Hughes, second by Representative Heffernan. Similar to Husky C, MedConnect is a program that benefits people with disabilities. This is a sliding scale program where working adults with disabilities can purchase Medicaid coverage, and this would be replicating the way the program works in Massachusetts. Any discussion?
Did you have to move it?
We did move it, yes. If there's no discussion, the clerk will please take the roll.
Senator Lesser,
Senator Lesser, aye.
Representative Gilchrist,
Yes.
Senator Seminara,
No.
Representative Case,
No.
Senator Gaston,
Gaston, yes.
Representative Dathan,
Representative Dathan votes yes.
Senator Marr.
Senator Marr votes yes.
One more time for me, please.
Senator Marr votes yes.
Thank you. Representative Butler, Representative Comey,
Representative Comey votes yes.
Representative Cook,
Yes.
Representative Fortier, Representative Heffernan, Representative Hughes,
Hughes votes yes.
Representative Johnson,
Johnson votes yes.
Representative Kitt,
Representative Kitt votes yes.
Representative Leeper,
Representative Leeper.
one time. You froze. Rep Leeper? Okay, we'll come back to you. Representative Santiago. Representative Buckby.
Representative Buckby votes no.
Representative Ferraro.
Representative Ferraro votes no.
Representative Mastro Francesco.
No.
Representative Pizzuto.
Pizzuto votes no.
Representative Paletta. Rep Leeper. Thank you.
Okay, number 13, an act concerning covenants not to compete in the home care industry. Is there a motion? Motion by Representative Cook, second. second by Representative Heffernan. This is 2019, the legislature and the implementer outlawed covenants to not to compete in the home care industry. This bill would repeal that. Any discussion? Seeing no discussion.
I move this to consent, sir.
Okay, without objection, item will be placed on the consent calendar. Item number 14, an act studying Medicaid for older adults. I am going to turn.
So moved.
I'm sorry, the motion was by Representative Hughes. The second was by Representative Cook. Prior to 2008, the legislature had an active program to allow certain non-citizens to qualify for nursing home expenses. It was frozen during the, I think the program still exists, but it was frozen to new applicants in 2008 or 2009 for budgetary reasons. Interested in looking at the program and seeing what's happened to folks now that they've been ineligible for it. So it's just a task force. Any discussion? Yes, Representative Cook.
So is the intention to, obviously you just clarified that it's simply a study
Mhm.
to figure out what's happening now.
Mhm.
And then from there, we'll take the recommendations, or is there an intention or direction of that study group?
I don't think we're looking to implement any recommendations at this point. I think we're just trying to figure out what's happening to older folks who are ineligible for nursing home care, Yes, Representative John, obviously that could later become part of legislation, but yeah, of course. Yeah.
I want to thank you for that. And that is one of the subjects of my complex care subcommittee meeting today. So just to let you know, we're looking at the mental health aspect of the refusals by the nursing homes to not admit people that have behavioral health issues. So thank you.
Thank you, Representative Johnson. Any other discussion? Yes, Representative Mastro Francesco.
Thank you. So to clarify, I always get nervous when we have a study because many times studies turn into legislation and they come before us. And if I'm not mistaken, we just recently passed in the last budget, we increased the age for healthcare for illegal immigrants, I believe up to 19. They're grandfathered up to age 19. Can you just clarify for me? You mentioned something that we were doing this in the past in 2008, and you said the program was frozen because of funding. Is that correct?
Yes, this predates my time in the legislature, but my understanding is that following federal legislation in the 90s, Connecticut, certain non-citizens who'd been eligible for nursing home care lost their Medicaid coverage, and so were no longer eligible. So the state of Connecticut stood up its own program to provide care. This is a group that includes recent legal immigrants, and that program operated for over 10 years, and then was frozen for new applicants starting in 2009, I believe. And I think the issue was just simply funding.
Thank you. And I certainly understand that it's just a study, but like I said before, I get concerned with certain studies because most of the time there is a recommendation, they turn into legislation. At the end of the day, it's a cost on the taxpayers should it pass. And I am, pretty adamant about taking care of our own legal citizens in this state, in this country first, before we expand that out. And I truly believe people need to come here legally. I understand it. But there's a lot of hardworking people out there that came to this country legally, and they're not getting benefits. So I'm going to be a no on this today. We'll hear the discussion. It'll be a lively debate, I'm sure, and listen to the public's comments on it. But I appreciate the dialogue. Thank you.
Thank you. And just to be clear, that the program, as I understand it, that existed, that accepted new patients prior to 2009, was limited to persons who are lawfully present in the United States. Any other discussion? Oh, I'm sorry, Representative Farrar, I apologize.
Mr. Chair, my question would be, is there any knowledge as to what the cost was of the program back in 2009 before it was shelved?
I'm sure OFA has that answer somewhere in the bowels of their department. I don't have that at my disposal, but that's obviously something we're going to look at.
Okay, thank you, Mr. Chair.
Thank you. Any other discussion? If not, the clerk will please call the roll.
Senator Lesser,
Senator Lesser, aye.
Representative Gilchrist,
Yes.
Senator Seminara,
No.
Representative Case.
No.
Senator Gaston.
Gaston, yes.
Thank you. Representative Dathan.
Representative Dathan is a yes.
Thank you. Senator Marr,
Senator Marr, yes.
Representative Butler, Representative Comey,
Representative Comey is a yes.
Representative Cook, Representative Fortier, Representative Heffernan, Representative Hughes.
Hughes votes yes.
Representative Johnson,
Representative Johnson votes yes.
Representative Kitt,
Representative Kitt votes yes.
Representative Leeper, Representative Santiago,
Yes.
Representative Buckby,
Representative Buckby votes no.
Representative Ferraro,
Ferraro, no.
Representative Mastro Francesco,
No.
Representative Pizzuto,
Pizzuto votes no.
Representative Paletta.
Okay, thank you. Moving on to number 15, an act concerning a study of Medicaid reinvestment. Is there a motion?
So moved.
Motion by Representative Gilchrist, second by Representative Hughes. Just really quick, this is another study, but here what we're doing is we're looking at the Department of Social Services at a time when we've got a lot of asks that we're making of the department. We're also trying to figure out if we can identify potential cost savings internal in the department to make things run more smoothly and also free up funds that we can use to invest in critical priorities. Any discussion, Representative Case?
Offer this for consent, please.
Without objection, will be added to the consent calendar. Item number 16 on the agenda, an act concerning Medicaid. Is there a motion?
So moved.
Motion by Representative Case, second by Representative Cook.
Move to consent.
Without objection. Yes, I think it's we can absolutely take it off consent calendar. You have to consent for it to be on the consent calendar. That is baked into the title. This is a what's the word? This is a placeholder item for potential future consensus legislation.
Okay, thank you. So it's a dummy bill. So I look at the heading of people here, this is what we get. All it says is Medicaid. I'm supposed to make it.
Could be anything.
Could be
Representative.
anything.
You got it.
I personally like to see what's in there, so I would ask you to do a roll call vote. on this.
Absolutely fine. The clerk will please call the roll.
Senator Lesser,
Senator Lesser, aye.
Representative Gilchrist.
Yes.
Senator Seminara,
No, because it's a placeholder.
Representative Case,
No.
Senator Gaston,
Gaston votes yes.
Representative Dathan.
Representative Dathan votes yes.
One more time for me, please.
Representative Dathan votes yes.
Thank you. Senator Marr,
Senator Marr votes yes.
Representative Butler, Representative Comey,
Representative Comey votes yes.
Representative Cook, Representative Fortier,
Representative Fortier votes yes.
Representative Heffernan, Representative Hughes, Representative Johnson,
Representative Johnson votes yes.
Representative Kitt,
Representative Kitt votes yes.
Representative Leeper, Representative Santiago,
Yes.
Representative Buckby,
Representative Buckby votes no on the placeholder.
Representative Ferraro,
Representative Ferraro votes no.
Representative Mastro Francesco,
Representative Mastro Francesco votes no.
Representative Pizzuto,
Pizzuto votes no.
Representative Paletta,
Representative Cook, do you have your hand raised?
Since we do have new members around the table, could you explain the concept of a placeholder? So they know what this is?
Absolutely. In some cases, we like having placeholder legislation because an issue will come up late in session and we will need to have a vehicle for addressing it. And it's usually something that is done with broad bipartisan consensus. But sometimes when you are looking to add content to legislation, you need to have germaneness. So the bill has to be about what the title says it's about. And so that sometimes it's good to have placeholder legislation to just maximize their flexibility. Hope that's helpful.
No, that's helpful. I mean, I know we have new members around the table, but I also know we have new folks in the room. I appreciate the clarification. Thank you.
And any school children watching on CTN will also be edified about how this place works sometimes. Representative Case.
And you will see no votes on placeholders because we do have statutory dates where bills have to be turned into the legislature. And if we don't have language or things that have concepts, we like the statutory dates to stay and not have something that we can pull out at the last minute.
Yep, absolutely. So moving on to number 17 on the agenda, an act concerning federally qualified health centers. Is there a motion?
So moved.
Motion by Representative Hughes, second by Representative Gilchrist. This is a motley assortment of requests we've received from federally qualified health centers around the state. I'm happy to go into them in as much detail as you'd like, but there are a bunch of them. Any discussion? Oh, you would. Okay. All right. So the ones that I'm remembering, there was an issue about when rates are set. There's a question about both what the rates are, but more importantly, I think to them is what month of the year they're set. I think we set them very late in the year, and they're looking to move it earlier. There is also a request about dental billing and regulations pertaining to that. There's other question about 340B contract pharmacies. There may be others, but I've forgotten them. I think that's the big ones. Any discussion, Representative Case? Senator Seminara?
This can be put on consent.
Without objection. Number 18, an act concerning Covered Connecticut 2.0. Is there a motion?
So moved. Rep. Hughes.
Motion by Representative Hughes, second by Representative Gilchrist. This bill would seek to expand the existing Covered Connecticut program to benefit more folks. Is there discussion? Yes, Representative.
Thank you. Can
Francesco.
you give an overview on the Covered Connecticut program and the expansion of more folks?
Yes, absolutely. So the Covered Connecticut program is a 1115 waiver that applies to the states, that marries the Medicaid program and Access Health CT, and it provides it eliminates premiums and cost sharing and provides dental and non-emergency medical support for low-income folks who might otherwise be on the Medicaid program or might not be able to afford private health insurance coverage. So it allows them to purchase health insurance coverage that they might otherwise not be able to. This particular proposal envisions a lower tiered program for folks who have higher incomes than the folks currently on covered CT that would provide a lower tier of benefits, but would help them with copays and deductibles on the exchange.
Thank you, Mr. Chairman. And one more follow-up question. Does this Covered CT 2.0 cover anyone regardless of immigration status?
No.
Thank you.
Any other questions? If not, Representative Case?
Go consent.
Without objection, will be added to the consent calendar. Number 19, an act concerning continuous Medicaid enrollment for children under the age of 6.
So moved.
Motion by Representative Hughes, second by Representative Gilchrist. We've discovered in conversations with the department that there's a certain amount of churn where kids who are on Medicaid lose coverage, not because of eligibility reasons, but for administrative reasons. And this would allow kids to stay on the program for 1 year. Is there a discussion? Seeing no discussion, the clerk will Representative Case.
We'll put that on consent.
Without objection. Item number 20, an act concerning Medicaid coverage of diapers. The bill does not actually cover Medicaid coverage for diapers, but it would do is allow students with no students, maybe students, I don't know. It would right now, Medicaid program pays for adult diapers when medically necessary, and this would allow medically necessary coverage of infant and toddler diapers when there is a medical condition that justifies it. So it's a much narrower version of what we've been talking about previously. Is there a motion? Motion by Representative Heffernan, second by Representative Gilchrist. Any discussion? Representative Mastrofrancesco.
Thank you, Mr. Chairman. Does the diaper, we currently have a diaper bank here right now, right? And I think it's pretty successful. Does that cover diapers? Would it cover diapers for medical purposes as well?
You're asking if the
The
diaper bank?
yeah.
I don't think the diaper bank restricts diapers on the basis of medical necessity. But I don't know whether or not they're able to meet 100% of the need.
So I guess, do we know a cost? Is this something from last year?
This is a much narrower version of what last year. The conversation was about whether or not the Medicaid program could pay for diapers. We're not looking to do that. We're talking about a narrow subset of infants and toddlers who have special medical conditions that would require a prescription of diapers, as opposed to, every child in the state.
I'll listen to it. Thank you.
Okay. Thank you, Representative. And yes, Representative Hughes.
Thank you, Mr. Chair. I just want to add that a lot of children that are coming back from the preemie units, the NICU units, kids with profound disabilities that are Medicaid eligible, this should be covered. It just should be, in my view. So to get Medicaid reimbursement for that would be super helpful for those families that are really struggling with children with profound needs.
Any other discussion, Representative Case?
I don't think, and I guess we'll hear it to draw it out. I did sit on that wonderful task force with Representative Gilchrist. But with somebody just coming home doesn't qualify them. It has to be a medical condition.
Correct.
So just coming home from the hospital doesn't qualify you. So we have to put those parameters. So it's probably going to be pretty strict parameters. So we just have to look at it. We're willing to hear it and see how it goes. We did find out that if we did it for all, the cost was atrocious. So.
Yes. Any Senator Seminar?
You could put this on consent.
Without objection. Number 21, an act concerning a study of private equity ownership in nursing homes. Is there a motion?
Second.
Motion by Representative Cook, second by Representative Case. This bill does what it says it would do. It would study private equity ownership of nursing homes.
Consent.
Without objection. An act concerning peer recovery support services, item number 22 in the agenda. Is there a motion?
So moved.
Motion by
Second, Representative Dathan.
Seconded by Representative Dathan. Representative Dathan, would you like to tell us about what this bill does?
Absolutely. So right now, only patients that are clients that are actually receiving peer support services who are inpatient in hospital are covered by Medicaid. This bill looks to expand that with also looking at the certain block grants that we have as part of our state budget. So we'd love to have a public hearing on this and continue the discussion.
Thank you, Representative. Any other discussion? Any discussion?
Yeah, we'll add this to the consent calendar.
Without objection. Item number 23 on the agenda, an act concerning Medicaid coverage of eligible school-based health center costs for special education students. We recognize we are not, I'll take a motion first. Motion by Representative Gilchrist, second by Representative Cook. We were recently contacted by the United States Department of Education indicating that Connecticut has not been doing all the work we should be doing potentially to bring in federal reimbursement for that small portion of special education costs that is reimbursable by the Medicaid program. We're looking to figure out if we can bring in more federal dollars to help defray the costs to local school districts into the state. Is there discussion?
We will move to consent.
Without objection. Number 24, an act concerning a study of Medicaid budgeting methods. Is there discussion? Is there a motion? Motion by Representative Johnson, second by Representative Heffernan. This bill would do what it says it would do, would study how we budget for the Medicaid program. It is a high-level concept bill trying to figure out how we appropriate funds in the program, if there's a way we can do so more effectively that helps us achieve whatever policy outcomes this committee decides to achieve. Yes, Senator Seminar.
It can go on consent, please.
Without objection. Number 25, an act concerning the home care program for the elderly. Is there a motion? Motion by Representative Heffernan, second by Representative Cook. This bill makes a number of changes to the home care program to the elderly. I think a number of them are from our colleague Senator Kelly. Looking forward to hearing more about them. Is there any discussion? Senator Seminar.
Consent, please.
Without objection. An act number 26, an act concerning fairness for families in the Medicaid program. Is there a motion? Is there a motion? Motion by Representative Santiago. Is there a second by Representative Pizzuto? This bill also, I think, has a proposal in it from Senator Kelly. Love to hear more about it. Is there discussion? Senator Seminar. Oh, yes, Representative Ferraro.
I understand that you're not quite familiar with all the aspects of this bill or this draft that's coming up. But my question is has there been determined there's an unfairness for families right now in the program? And could you just elaborate on that a little bit?
I will recognize Senator Seminar for discussion.
There has been an identified unfairness to certain families, and this is why Senator Kelly has raised this. I will be more informed at a later date.
Thank you, Mr. Chair.
My pleasure. Any discussion? Senator Seminar.
This can go on consent.
Without objection. Next item is item number 27, an act concerning access to the Alzheimer's disease respite care program.
So moved.
Motion by Representative Hughes, second by Representative Santiago. And this is another request we've received from Senator Kelly, and would do what it says it would do. It would actually expand the, I think, the income threshold and the asset threshold for participation in the Alzheimer's disease respite care program. Is there any discussion? Representative Case? No. Senator Seminar.
On consent.
Without objection. Number 28 is an act concerning emergency Medicaid. Is there a motion? Motion by Representative Gilchrist, second by Representative Johnson. This bill seeks to, I believe, codify current practice by the Department of Social Services. We did have an issue where some residents were parked in acute care hospitals because they were unable to receive emergency Medicaid outside the hospitals. Then the Department of Social Services fixed the issue, but they did so administratively. This would seek to codify that practice. Is there discussion? Yes, Representative Johnson.
I hope that our question is, will we be focusing on EMTALA? The emergency medical treatment and labor and delivery aspects of treatment for emergency services.
Now we will.
Thank you so much.
Any other discussion? Representative Mastro Francesco.
Thank you, Mr. Chairman. Mr. Chairman, is this the what we have right in place right now? Is this expanding this service to undocumented?
No, it wouldn't expand it. It already covers. So the issue was, as I understand it, that there was a number of dialysis patients who are undocumented, who were forced by the Medicaid regs as they existed. They presented at hospitals in Connecticut seeking dialysis, and they received dialysis, but the hospitals had to admit them as inpatients. And so they were actually living in Connecticut hospitals, costing taxpayers a fortune. And so Department of Social Services was able to figure out using the Medicaid program, how to get them emergency Medicaid so they did not have to live inside the hospitals. And this would simply codify that practice.
Okay, thank you. I do have some concerns and questions, but I guess I won't know that until the bill is raised. So I will certainly listen to that.
Yeah, and just to clarify, this would my understanding is that this seeks to clarify this codify current practice. Representative Cook.
Thank you.
And thank you, Mr. Chairman. And just for clarification, this would not remove somebody from the hospital. In fact, they did need that hospital care because we do know that there is a a push from our hospitals to get people out very quickly. So I think that there's an equal balance to this. And so would we be also looking at the other side of this?
Well, I think this originally, I think request came from the hospitals that they were trying to get people, they felt that folks were moving into the hospitals and could not leave the hospital, and that was preventing space from going to residents who needed more acute care. So this was,
But I think that goes to my point, right? So I think that we need to rely on the doctors to ensure that the patients are where they need to be and not a hospital to tell them where they should or should not go. Because in fact, we know that there is this speedy exodus and it's kind of like the rotating door, and we put patients' care at the, in jeopardy because of that. So I want to make sure that whatever we do with this, it's got patient care at the forefront.
100%. Excellent point, Representative. Any other discussion?
Can go on consent?
Without objection. Item number 29, an act concerning supplemental nutrition assistance program. Is there a discussion? Representative Hughes, motion.
So moved.
Second by Representative Cook. This is a repeat from last year. First section would simply seek to stagger the date that residents receive their SNAP payments so that they're not all on the same day. We're also taking a look at the restaurant meals program as it exists in some other states. Is there discussion? Senator Seminar.
Can go on consent?
We're getting there. Item number, without objection, will be placed on the consent calendar. Item number 30, an act concerning Medicaid coverage of rapid whole genome sequencing for critically ill infants.
So moved.
Motion by Representative Johnson, second by Representative Santiago.
Consent?
Without objection, will be placed on the consent calendar. Number 31, an act concerning Medicaid coverage of biomarkers. Is there a motion?
So moved.
Motion by Representative Santiago, second by Representative Cook.
Consent?
Without objection, we'll place on the consent calendar. Item number 32, an act concerning inflationary rate adjustments for human services providers. Is there a motion?
Second. So moved.
Motion by seconded and firsted by Representative Santiago. No, is there a second? A second by Representative Heffernan. Yeah, so this is a request that we received from the Nonprofit Alliance. Is there any discussion?
This can be placed on consent?
Without objection. Number 33, an act implementing the Certified Community Behavioral Health Clinic Model in the Medicaid program. Is there a motion? Motion by Representative Hughes, second by Representative Cook. This is also from the Nonprofit Alliance.
Consent, please.
Without objection. An act concerning, number 34, an act concerning a study of state-funded assisted living services. Is there a motion? Motion by Representative Hughes, second by Representative Cook. This is a concept from Senator Martin looking to see if we can apply state funds to assisted living facilities.
Consent, please.
Without objection. Number 35, an act concerning a study to maximize federal funds for Yukon Health. It does what it says it would do. Is there a motion? Motion by Representative Hughes, second by Representative Cook. Is there discussion?
Consent, please.
Without objection. Number 36, an act concerning various revisions to the human services statutes. Is there a motion? Motion by Representative Hughes, seconded by Heffernan, Representative Heffernan. This is our DSS bill for the year. Is there any discussion?
Consent, please.
No, Representative Mr. Francesco, I'm sorry. Yes,
I'm sorry. I just had a quick question.
absolutely.
What kind of technical revisions are these? Do we have any?
I'm sorry, this is the various revisions bill. So the various revisions, it's an agency bill from the Department of Social Services.
Hold on,
This is number 36 on the agenda.
okay. It just seems that there's 36 and 37 are identical, and I don't know.
They're similarly titled. 36 is I think I can say this, a relatively minor bill requested from the Department of Social Services of cleaning up their statutes. We'll hear about that in a bit. 37 is an LCO revision to the statutes. They're doing grammatical cleanup to the statutes, whereas 36 is from DSS. So they're
Okay.
from different places, Representative.
Thank you for the clarification.
Consent, please.
Without objection. An act, number 37 on the agenda, an act concerning technical revisions to statutes concerning human services. Is there a motion? Motion by Representative Gilchrist, second by Representative Cook. Any discussion?
Consent, please.
Without objection. Number 38, an act expanding concerning expansion of the Katie Beckett waiver. Is there a motion?
Second.
A motion by Representative Cook, second by Representative Johnson. Is that,
Oh, Santiago.
oh, Representative Santiago, you sounded similarly for that moment. Sorry about that. Sure, we're playing it fast and loose today. So this is a proposal intended to provide healthcare to very sick kids in the state, looking to expand the program and adjust the waiting list. Any discussion? Senator Semenuk,
Consent, please.
without objection. Okay. And now I think Madam Clerk, can we move straight to item number 4 before having we have to vote on the consent calendar? Okay. Madam Clerk, when you've caught your breath, can you please, I'd like to call the roll on the consent calendar, but would like you to please just walk through what's in the consent calendar before we do that. Yes, the numbers. The numbers are fine, please.
Okay, just
I
the
think.
numbers. Great. All right.
Otherwise, we'll be here all day.
You have item number 1, item number 2, 3, 5, 6, 7, 8, 9, 10, 11, 12, 13.
Oh, no, I don't think 12 was on I don't think 12 was on.
Sorry.
It's not.
Should I start from the top?
Yes.
Okay. All right. Items on the consent calendar. Item number 1, 2, 3, 5, 6, 7, 8, 9, 10, 11, 13, 15, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, 32, 33, 34, 35, 36, 37, 38.
Okay. Will the clerk please call the roll?
Senator Lesser,
Senator Lesser, aye.
Representative Gilchrist,
Yes.
Senator Seminara,
Yes.
Representative Case,
Yes.
Senator Gaston, Representative Dathan,
Representative Dathan votes yes.
Senator Marr.
Senator Marr votes yes.
One more time for me, please.
Senator Marr votes yes.
Thank you. Representative Butler, Representative Comey,
Representative Comey votes yes.
Representative Cook. Yes. Representative Fortier,
Yes.
Representative Heffernan, Representative Hughes,
Yes.
Representative Johnson,
Yes.
Representative Kitt,
Representative Kitt votes yes.
Representative Leeper, Representative Santiago,
Yes.
Representative Buckby,
Okay.
no, sorry, we're still on.
Oh, I'm sorry.
Representative Ferraro,
Representative Ferraro, yes.
Representative Mastro Francesco,
Yes.
Representative Pizzuto,
Yes.
Representative Paletta. Thank you.
Sorry about that. I'm glad everybody could vote. We're going to be holding the votes open again until 1:30. And then before I forget, we do have one additional item, number 4 on the agenda. We have a vote to draft committee bill, and I'd like to entertain a motion to draft proposed Senate Bill 8, an act concerning drug affordability.
So moved. Seconded.
Second.
Motion by Representative Santiago, second by Representative Dathan. This is a Senate leadership priority focused on lowering drug costs for the Medicaid program and for everyone else. Is there discussion? Yes, Representative Mastro Francesco.
Thank you. I'm looking at the language because we do have a little bit of language on this bill. And it says the general statute be amended to require the state employee health plan for each category of insulin to cover the lowest wholesale acquisition cost of insulin at no costs to enrollees. So if I'm to understand this correctly, Mr. Chairman, this is for state employees only through you?
Well, that apparently is what the proposed bill says, but it's our intention to apply that as well to the Medicaid program, and then make that available as well to, to other folks in the state as well.
Thank you. So just a couple concerns on this is that I think it was a couple years ago, we did vote in the legislature to cap the cost of insulin. And that cap was only for specific point through the exchange. That was only through the exchange.
So you're right, the gentlelady's correct that covered fully insured plans, but that is only a portion of the marketplace. There are certainly folks out there who don't have fully insured plans.
Right. And that is always my concern when we get into the discussion on this is we have select few people who certainly benefit from these type of programs. And then there's a lot of people out there that are certainly have no insurance and they're paying out of pocket. And when that happens, and when we do this, now the state is going to cover the complete cost. There's no out-of-pocket cost to the state employees. Believe it or not, the people who have no insurance and that are paying out of pocket are covering that cost, because eventually what happens is the insurance costs go up for this insulin and somebody has to pay for it. And if the state is covering all the costs, that's really taxpayer money. These kind of things certainly concern me. So I'm going to be a no on this today, but I'll hear a lot of discussion on it when it comes before a public hearing, which I'm assuming there will be a public hearing on it. Is that correct?
If the vote is favorable today, yes, we will schedule everything we vote yes for a public hearing. That's our intent.
Well, I can't imagine the vote in this committee with us being in the super minority is not going to pass. So appreciate the dialogue. Thank you.
Thank you, Representative. Other discussion? Representative Case.
Thank you, Mr. Chair. And I think this is a different animal here because we're not voting to draft. This is a drafted bill, and the bill is specific. It actually says state employees health plan. If we're going to take that bill and expand it, that's not what we're here to do. We're here looking at a drafted bill. It's not one to be drafted. So I'll be voting no for it today. It's already a bill.
Representative Cohen.
Thank you, Mr. Chairman. So I need definite clarification on this. So if I heard you correctly, it says that they have to cover the lowest cost insulin, correct?
Correct.
So you're now dictating what insulin a doctor can prescribe to a diabetic patient, correct?
No.
Explain the difference.
So the issue is not whether the doctor can prescribe whatever insulin the doctor wants to prescribe. The question is, what does the formulary include the lowest net cost insulin? So whether or not you have access to it, if your doctor prescribes it to you. So whether or not the state would pay for it, not in this case, not whether or not the doctor would decide
But within your summary, you had said the lowest cost insulin that would be covered by this bill. And so then if that is the case, then that means the only thing that would be covered would be the lowest cost insulin. And so my question is that written in the bill correctly? Or is it something that's going to need to be changed in the bill to ensure that a doctor has the right to prescribe accordingly? And the other question that I have is, have you had a conversation with the comptroller on whether or not this is legal? Within the contract of the negotiations of CBAC and all that other stuff?
So first, there would be nothing in the bill that would restrict, thank you for that question. There'd be nothing in the bill that would restrict the ability of a doctor to prescribe whatever the doctor decides is in the best interest of the patient. That's not the intent of the bill. The question though is, there are new nonprofit drug manufacturers that are making lower cost insulin available on the marketplace. And this would be allowing Connecticut residents to get access to that new low cost insulin if the doctor and the patient decides that it's appropriate for them. And if they decide not to, that's fine. There's certainly plenty of commercial products that are currently on the market.
So then I guess my question is, what's prohibiting them from doing that right now? Why do we need to direct that to happen if that is already, if it's out there on the market, why do we need to tell them to do it? And then I'm going back to the other thing. Is it legal? Because this would violate the contract of our CBAC agreements. And I know the only reason why I'm pushing back on this is because I had the same issue when I was trying to do the dental bill for kids. Because the things that happen with with everybody else doesn't necessarily happen because it violates our contracts.
Right. So first off, I think the product's not currently on the market, so that's why it's not available, because it's not on the market quite yet. One of the issues we've seen though is that formularies are often dictated by complicated rebate agreements and whatnot. And so what we're trying to do is make sure that this low cost insulin is just available to folks if they decide that it is the doctor and the patient together decide that that's what they're looking to get. And there are certainly plenty of commercial insulins that are available in the market. I'm not aware of any legal reasons why we couldn't do this, but certainly we'll welcome conversations with the comptroller's office if there are issues, and I'm sure his feedback would be usually helpful.
So then I have a request. Can, and not out of disrespect to the chairs, by no means, but can we just hold this for a minute? Have a conversation with the comptroller before we have a public hearing and find out it may or may not be legal? I'm not saying that I'm opposed to something that's not illegal, but if we're talking about an insulin that's not on, if we're talking about an insulin that's not on the radar yet anyway, but maybe it's coming, I just want to make sure that we're doing this right. And I hear the intent, I believe, but I'm also hesitant. I don't want to have to vote no, because I firmly believe in, I mean, I have a mother that has diabetes. I firmly believe in protecting that population. I just want to make sure before we do something that we don't violate any contract negotiations.
What I can say is that if that is a concern that we will violate the law or the CBAC contract, that the provision related to the comptroller's office will not move forward. But because this is a Senate leadership priority, I think it would be helpful to schedule it to flesh out the bill and to have a public hearing, and then we could gather input from the comptroller, from health plans, from pharmaceutical manufacturers, and see if this makes sense or not. So I would request at this point that we schedule a vote now, and that we have the hearing and find out, whether or not this makes sense. Yes, Senator Seminar.
My concern with it, I have many concerns with this, but one of my concerns is that this is only for state employees. It's clearly stated that it's only for state employees, so that is a concern. And my other concern is that you are telling me we are taking a vote on a drug that isn't even on the market yet, according to you. This drug hasn't been approved and people aren't using it yet. So we're taking a vote on a drug that hasn't been approved.
Well, okay. Thank you, Senator Seminar. Just a couple of points. One, I think we would intend to flesh out the bill to cover a larger subset beyond state employees. Second, with regard to the bill currently says the lowest wholesale acquisition cost of insulin, that's whatever drug on the market is the lowest wholesale acquisition cost. It doesn't specify a specific drug. We're trying to make sure that the lowest cost drug is made available to folks.
But did you not mention earlier that there were certain drugs that you were, for lack of better words, targeting that are not on the market yet?
Well, it's our hope that we can bring that to the market, make them available to Connecticut residents. That's correct. But there's nothing in the bill that says that we're not going around the FDA or anything like that. We're not making a drug that's not available based on regulatory issues.
Okay, I'll be a no today.
Okay.
Thank you.
Thank you. Any other discussion? Representative Johnson.
So this may be a little bit outside, but what would the impact on the PBMs be in terms of how this works? Because it seems as though there might be an interaction here and a way to take a look at what's going on with PBMs and these types of drugs, the kickbacks, in other words.
Thank you. Your word, not mine. But I would just say that PBM contracting is immensely complicated and above my pay grade. But what the intent of this is to be
our list of bills to be drafted. This is a proposed draft, SB 8. It says specifically, and there's language on the system. For that reason alone, we have a draft bill with language. I'm a no.
Thank you, Representative. Any other discussion? Yes, Representative Master Francesco.
Thank you for the second time. Just quick follow-up. Something like this, wouldn't this bill really go through insurance committee?
Through you, I don't think so. But again, that would be a question for the screening committee.
I'm not on screening, so, okay, thank you.
Yeah.
Yes, Representative Pizzuto.
Thank you, Mr. Chair. I've had conversations. I have an opportunity to serve on the Waterbury Hospital Board. There's a huge demand for a drug called Ozempic, which the doctors are finding it's great for insulin, but also for weight loss. If the formulary says, well, I can get 2 for 1, I mean, it's a very expensive drug. wouldn't that negate the cost of the lower insulin, whatever that generic drug may be, in favor of an Ozempic type of drug, which would cost us a lot more, whether it's a state employee or not?
I don't think anything in the bill intends to cover the provision or not of Ozempic or other weight loss drugs or other non-insulin diabetes treatments.
Thank you.
Thank you, Representative. Yes, Representative Cook.
Thank you, Mr. Chairman. I have one more question. So are we not being put in the position to override our own state contract then if we're voting on this, if it's only for state employees?
We don't believe this would override our own state contract, but we'll find that out in the public hearing. If there's no further discussion, the clerk will please call the roll.
Senator Lesser,
Senator Lesser, aye.
Representative Gilchrist,
Representative Gilchrist, yes.
Senator Seminara,
No?
Representative Case,
No.
Senator Gaston, Representative Dathan,
Representative Dayton votes yes.
Senator Mar,
Senator Mar votes yes.
Representative Butler, Representative Comey,
Representative Comey votes yes.
Representative Cook, Representative Fortier,
Yes.
Representative Heffernan, Representative Hughes,
Representative Hughes votes yes.
Representative Johnson,
Yes.
Representative Kit,
Representative Kit votes yes.
Representative Leeper, Representative Santiago,
Yes.
Representative Buckby, Representative Ferraro,
Representative Ferraro votes no.
Representative Mastro Francesco,
Representative Mastro Francesco votes no.
Representative Pizzuto,
Pizzuto votes no.
Representative Paletta.
Paletta votes no.
Thank you.
Okay, so that concludes our business for today. We will hold the votes open as previously stated until 1:30. Announcement of time and date of next meeting. I should have this, but I believe it's on Tuesday, Tuesday the 20th at 11 a.m. Is that correct, Madam Clerk?
10 a.m. Tuesday.
At 10 a.m. Sorry for, you got to get up an hour early. Okay. And with that, I would like to recess this meeting of the Human Services Committee.
Hi, Rep Buckby. Sorry, I didn't realize I had you on mute. How are you?
It's all good. I was like, oh no, I lost her. I
I'm
tried.
sorry. Okay. So what did you miss? Let's see. We
So I made it through to 16.
made it through 16. Okay. So then we
So-
voted on,
17 through 38 were all on consent though, right?
I'm sorry, say that one more time.
17 through 38 were all on consent.
Yes, for the most part. Yep. 7-3, yep. The rest were on consent. Yeah. So we
Okay.
on the consent calendar.
Okay, yep.
Thank you. And then SB8 was a vote to drop.
Yeah, that's a no for me
No.
and no for Buckby there.
Thank you. You're all set. We'll see
All
you
right,
next
thank you so much. We'll see you
Okay,
soon.
well,
Thank you. Bye-bye.
Hi.
Thank you so much.
You're welcome. Okay, so we got item number 4 for you. Item number 12. That was an act eliminating the income and asset limits in the MedConnect program. How do you
Oh,
vote?
yes.
Thank you. Then we have item 14, which was an act study in Medicaid for older adults.
Yes.
Thank you. Item number 16, which is an act study Medicaid, that was a placeholder.
Yes.
Thank you. And then the consent calendar, that was basically everything 1, 4, 12, 14, 16.
Yes.
Thank you. And then last but not least, is vote to drop the FB.
Yes.
Thank you. You're all set. See you next Tuesday.
Thanks, Chandra.
Thank you. Bye. Hi, Representative Butler. Hello. Oh, I can't hear you. You're on mute. Let me.
Hi, finally. I'm sorry. It's been a hectic morning.
No, you're fine. How are you?
I'm trying to get it all together here, but thanks
Sure.
for sending me the meeting ID and passcode. Usually I can get in if I have that. Sometimes on my phone, I can't just click the connection to the email or my Safari doesn't work that well. So
No worries. All right, let's get into it. So I don't know if you have the agenda on hand, but first thing that was on most of the items were on consent. So then we have item number 4 on the agenda, which was an act concerning Medicaid coverage for infertility treatment. How do you vote?
yes,
Thank you. Next, we have item number 12 on the agenda, which is an act concerning eliminating the income and asset limits in the MedConnect program. How do you vote?
yes.
And these are all concepts to be raised, by the way.
They're what?
They're concepts to be raised.
Yes, yes.
Thank you. So item number 14 on the agenda, which is an act concerning studying Medicaid for older adults.
Definitely.
Thank you. Next is item number 16 on the agenda. It's an act concerning Medicaid. That is our placeholder bill.
Yes.
Thank you. Item number, that's it for the ones that were not on the consent calendar. Do you need me to read you the items that were on consent? Which items?
No, I've seen the agenda. I'm good. We
Vote
could,
yes?
I could vote yes on a consent calendar because
Thank you.
thank you for sending the agenda because I was able to look at it and, I'm good.
Okay, great. And then last but not least is a vote to draft. That's SB 8, an act concerning drug affordability.
I couldn't hear you. What affordability?
SB 8, an act concerning drug affordability.
Yes.
Thank you. All right, you're all set. We'll see you next Tuesday.
All right. Thank you very much. So yes, if you could, to the meetings, if you could just send me the meeting ID and the passcode, I can usually use my phone or my laptop to get on.
You got it. Thank you.
Thank you so much.
Take care. Bye.
Yep. Bye-bye.
Hi, Senator.
Hello, how are you?
Good. Right in the nick of time.
I know, no, thank you so much anyway for nudging me on that. I was just on another call. I wasn't gonna forget.
No, we're all
Yep.
busy. So let's cut to the chase. So I'm missing a vote for you on the consent calendar.
Yep, I vote yes.
Thank you. And then last but not least, SB 8, that was a vote to draft.
Yes.
Awesome. Thank you so much. You're all set.
Thank you. Take care. Bye-bye.